Hi, it's Dr. Tim. In this video, we're going to talk about rhinoplasty. We'll cover what it is, how it works, and what you can expect during the recovery process. Rhinoplasty is a surgery that gives us the ability to create a nose that fits your face and profile. There is no cookie-cutter nose job that can be applied to all patients, and so it's important that we identify the aesthetic that suits you. Your consult starts with a thorough understanding of your nasal history and a physical exam. Seasonal allergies, chronic sinus problems, and old nasal trauma can all play a part in creating that ideal treatment plan. During your procedure, I may straighten your septum or create internal splints to improve airflow. No matter how aesthetically pleasing a nose is, if it doesn't work, you'll be frustrated. A rhinoplasty can be performed with or without an external incision across the columella. The interesting balance of rhinoplasty is that many times we are making the nose smaller, more delicate looking, but actually stronger. We typically borrow cartilage from your septum to be able to add strength to the tip, and it can be used to improve function as well. If you've had previous nose surgery, cartilage may be needed from another part of your body. Possible locations include ear, rib, or even donor cartilage. Let's take a look at a couple of cases. This beautiful young woman came in with concerns of fullness on the dorsum of her nose, as well as a plunging tip when she smiled. The plan that we created for her was to be able to bring down that dorsum a little bit, to be able to give her a more feminine profile, as well as refine the tip of her nose, give her some additional projection, and just a little bit of rotation to be able to minimize or eliminate that plunging tip that she was concerned about. You can see her here 9 months after surgery. She's well healed, she's got a beautiful nose, and she is over the moon. This young woman came in, she was concerned with a bump on the dorsum of her nose, and she also felt like the tip of her nose was boxy. In addition to that, she also felt like she had a little bit of a crooked nose that she was hoping to straighten. The plan we designed for her was to be able to bring down the dorsum, straighten the nose, refine the tip, and give her a nice, subtle, feminine super tip break. You can see the patient here 3 months after surgery. Much of the swelling is gone, though there's still a little bit in the tip. Her scars will continue to improve, but already she's experiencing more confidence and absolutely loving her results. Recovery requires about 1 week. There is very little discomfort after nose surgery, and most people report about 1 out of 10 on a pain score. Strong pain medications are not typically required after surgery. You'll have a splint on your nose for 1 week, and when you come in for that first appointment, I will remove the splint and take some small sutures out if an incision was required on the outside of your nose. I still recommend wearing that splint at night during the 2nd week. I like to use a modern technique called preservation rhinoplasty in order to be able to reduce your downtime and swelling. Lastly, nasal surgery is like a fine wine. While typical downtime is about 1 week, it is critical to be patient with your healing, as little details and features of your nose will continue to improve over the course of a year. The nose is very delicate, and even small amounts of swelling can be noticeable. In general, if you have thicker skin, it will take longer for that swelling to resolve. If you are considering nose surgery, I'd be happy to meet with you and create your unique plan. We look forward to meeting you.